It's a pleasure to be here, and of course I'm humbled by this audience. This is an extraordinary audience who's very knowledgeable. But just in case, I know we've talked about the magnitude of oral disease, but here's a slide from the World Health Organization. You see that blue sphere? That's oral disease. All of the other spheres, as you can see, are quite a bit smaller. Most of them, if not all of them, could fit within that blue sphere. So that's the magnitude of the problem that we're dealing with. It's pretty great. And what's the army that we have? Who's the army that's going to go and fight for that oral disease in that blue sphere? We're going to be talking about that army, some of it. Yes, we don't have time to discuss every aspect of oral health workforce. It would be great if we did. It would probably be a couple of days. So we're going to limit ourselves to certain aspects of it, and we have expertise to help us understand it. So if I were going to use this as a simulation of the oral health workers, what would be my first blow? What breath would be the first blow into the balloon? Who wants to help me? Not blow the balloon, but what's the first? The first one is what? The dentist. So we have to please imagine, play with me a little bit here, that this is a balloon that has no limits. I could blow and blow and blow into it. It would never break. The sides would be resilient. So that first blow, the dentist. What do we know about the availability of dentists? And who are the experts that are going to help us with that? So Dean Ahmed Ismail is going to be the first one to help us. He is going to give us a perspective of the landscape of dental schools and dental distribution.
Thank you, and thank you, Joe. I've enjoyed the last hour and a half where I was able to join you. This is my third city in 5 days. Plane, train, and car. So I'm here today. I survived since last Sunday. What I'm going to try to do is to share with you the thinking of teams and systems, because there's a lot of, maybe if you think in piecemeal, the picture is not right. So the first slide I'm going to have is just understanding what we're suffering from in dental education is very important. And access to dental care and how we train a dentist and how many we train them. Now, I'm used to have a screen in front of me. Oh, there is a screen in front of me. Good. So just to show you where our graduates are located, we are the school. I wouldn't call our school the Pennsylvania School because there's the University of Pennsylvania. But Temple has graduated a lot of dentists. About 35% of the dentists in Pennsylvania are from Temple. So we have a wide spread in the state, but not enough. There's a lot of gaps that we need to address. Now, there's a call always to train more dentists. If we have a problem, do more of the same solution that didn't work. Yes, we need more dentists, we need more hygienists, we need more providers, but we need systems. So currently there's 71 schools accredited in the United States, and you can see the graph how the schools numbers increased, and there are 5 coming. And all of them are happening in small communities, and it's not in major cities, and they're all in osteopathic medicine schools. You charge $100,000, $120,000 a year, you locate them in a rural area, provide them some training, meet accreditation standards, and that's it. That's not the solution. So I just want to give you also how we work, because Temple is positive in its budget. However, I give money. The state doesn't give me money. Right now, I give money to the university. The university gets all the money from the state, $157 million. I don't get money for it for a dental school because the dental school is successful. Based upon tuition, which is not the highest in the country, or to our counterpart, and also about clinical income. So the point of financing of dental schools is very important. when we train more dentists, and I switch the sequence of the slides in my other presentation, is that this shows very clearly, if you can read it, is a study by the American Medical Association, published in the American Medical Association Journal, and January 22, is that we train more dentists, but they go to urban areas. And actually, this trend will increase because in this generation of graduates have totally different life wellness balance. They work on they don't want to work on Monday, but on Tuesday from 9 to 4, and on Wednesday from 12 to 8, and they want to take Friday off and Monday off. It's a totally different generation we deal with, and we need to understand and plan accordingly. So we have, just to tell you, we accept 140 students. We have a large pool of 2,600 applicants for these 140 seats. We have 10 seats for international DMD program, international dentists. This is the growing population. It grew by 11%, while everything else is dropping by 1 to 2%. We have 10 seats in the third and fourth year. We have qualified candidates selected to interview. But if they meet two things, the quantitative criteria are important, but we put about 60% on quantitative and 40% qualitative. Qualitative is volunteerism, working in community efforts, volunteering, working in the Peace Corps, working in Teach America, or they have life experience serving in the military, career that provide them a different perspective on life. So that's how we, then we have an interesting test, it's called Casper, look at general ethics. We exclude 1 or 2% of the applicants because the ethical standards doesn't fit what a profession is. People steal and they say it's okay, they need the money. We have admission committee, we have a thorough process. Look at the number of applicants or percentage of applicants coming. We have almost equal number of, we have to divide them because we're required to report based upon race and ethnicity. A large segment is Asian Americans applying to dental schools, which is across the country. And a large number of whites, of course, but then the minority population is up and down. The dearth of African American applicant is a problem. And there's a high competition for the candidates in terms of scholarship and support. We have increased it by restructuring our scholarship. We are now having each class 3 to 4 students, African Americans, I would say correctly, Black Americans, because a lot of people claim that they are African Americans because they are from North Africa, but they're not Black Americans. So the 9 to 10% of the applicants are from Pennsylvania, only 9 to 10%. But we accept 35% of our class. So we are not biased towards Pennsylvania. We follow the same guidelines, and we accept a lot of Pennsylvania residents. Remember that we're not getting money from the state, just like Pennsylvania, University of Pennsylvania, and maybe the University of Pittsburgh. It depends how Pittsburgh allocate the money. So the difference between tuition is about $7,000. I calculated that if we charge all the students out-of-state tuition, as a private school, we'll be making $2.5 million. I could fund a lot of programs with that. So all I'm saying is that we are ready to start a rural track for education. And that will be done the following way. We'll build the clinics in shortage areas. We'll have housing in shortage areas. The students will be selected to serve in these, to work in to study in these areas. Combination between, Temple, North Broad Street and Temple rural area, and we'll provide care, and then they will stay and get loan repayment. That model we need to test for how we increase rural dentists and also rural dental assistants and hygienists in the community. Thank you.
My next question I'd like to address to Dr. Gluch and Dean Ismail, and that is, what are, as they see it, the barriers for dental school applicants? What do they face in applying to dental school? Ahmed, if you would take that first.
One of the is, as I said, we use a holistic approach, but I have an admission committee of faculty who still insist that the GPA should be this level and the DAT should be this level. It is important because one of the pains that we suffer from is a student who cannot pass the board exams. And then they stay for 6 years, and they have accumulated $400,000 tuition. So the selection criteria are important that they could pass the exams, pass the written exam, pass the clinical exam. We started a post-baccalaureate program, and that is for students who are at the edge. It is a successful program. We are currently, I could spend about an hour talking about that. This is the issue. When we started it, we were accepting 2.8, 2.9, DAT of 17, 18. Then these new schools opened, and they start to accept our post-baccalaureate students. So now our GPA went down to 2.6, 2.7. The placement rate is about 83%. They will be accepted in a dental school. We take about 30 students from our post-baccalaureate program. So it is a successful program to address this issue. And they, regardless of where they are, our training for them enable them to move to be competitive, because we rely on the grades in the post-baccalaureate program. GPA of 3.5 on translational courses. They also trained as dental assistant and passed 3 DAMBI exams. So they really can work as dental assistants and get money while they are in school. I think that's...
Put that up, the post-baccalaureate slide. Can you put that up?
This one?
Yes. Yes.
So I think I said that. Majority, so we started with 80 students, now we're down to 60 students because these other schools that are opening need to fill their classes and they take them. There is a big issue in dental education now is the level of clinical training that the students receive. I would say it's minimal, and that's a problem. At Temple, we maintain the brand of clinical work. Our students do a lot more work than relatively other schools. And when they go to residencies and work in clinics, they immediately come back to us and say, wow, I didn't know that we have done so much compared to the other ones. So I said that over half are over half of all students who completed the post-baccalaureate program were admitted to the Temple Dental School. So that is a success. We opened the door for people who are at the edge to move to be competitive with other students.
Thank you. Joan, would you please address that as well? What you see as barriers to admission, which could be, of course, a factor in the diversity that we see in our dental schools.
Sure. Thank you for that question. Thank you for the question. And think about it. We're asking individuals to do 4 years of college and 4 years of dental school, which is really a long haul for many people. Now, many foreign dental schools have 6-year programs. So we've had, for the past 20 years, articulation agreements with the University of Pennsylvania undergrad, Villanova undergrad, Muhlenberg, variety of universities that shorten that so that it's 3 years undergrad and then 4 years dental school. And 2 years ago, we decided to let anyone apply. You wouldn't have to be at an articulated school with just coming in with 3 years of dental school. Our experience is that, of course, we have to be very careful in looking at individuals. But, as I talked about this morning, I think we have to rethink our assumptions. And we may not need those full 4 years of education prior. It may be a faster process for those talented individuals who know they'd like to go to school. So I think that's one specific thing that we're looking to publish and disseminate our results. The good news is that the Commission on Dental Accreditation doesn't have any specific requirements for that, where they have requirements for lots of other things, but we're okay in taking students without the full 4 years. And I really echo Dean Ismail's sentiments. We have a master's program that does prepare individuals for success. It's now only 3 years old, but we've had similar success rates. It's with very few students, but I like the idea of post-baccalaureate or master's programs to help students, give them an additional chance. However, that means that's an additional year, it's an additional tuition. So, that's something that we may want to consider as well.
Thank you. So what's my next breath? First breath is dentist. What's second? And then third? Dental assistants, right. So we have to have some discussion about that. So let's now please turn to our other panelists to talk about the recruitment issues about recruiting and training dental assistants and dental hygienists. Anyone who wants to raise a hand and respond, you got 2 minutes. Michael.
My partners and I have a dental health system in the area. We are no outside capital, owned by dentists that practice, that see patients every day, myself included. We have ancillary companies that are owned by dental hygienists, like our real estate and dental assistants and our employees. We just leased or bought some real estate. I was inspired by your slides, Dean, so I just made some of mine. So we just acquired 11 operatories within 5 minutes of where we're sitting right here. These operatories are fully equipped. They were walked away from by dentists that do not have people to staff them. We're looking at 9 more today. 9 more operatories, another fully equipped office, okay? Now we have dentists. We just hired in the last 3 months 3 doctors. We've had 20 applicants for those doctors. So I have no FDAs, I have no hygienists, but I do have doctors. Here's the problem. I don't have as many numbers as you. This is the debt that those 3 doctors have. $900,000, $600,000, $450,000. Okay, the top one is a periodontist, so they paid for the extra debt. Here's the second problem. The cost is much greater than the reimbursement that we are getting for preventative and diagnostic care. So I have 4 of my 22 dentists have come to me asking to expand their scope of service. I'll give you one guess what they want to do. What's that? Botox. They want to do Botox. They don't want to do Profies. They get a percentage of what they get reimbursed. They cannot make money. They cannot pay their debt on Profies. You call one of our offices. Doc, I think you know Ryan Rother, right? Do you know Ryan? Okay.